We also distribute our papers to government to maybe it will be useful or benefit for policy makers. How can we minimize the source? How can we reduce the exposure of air pollution in Thailand? That will be benefit for people. We can reduce mortality rate. We can reduce morbidity rate. It will be good for our health. สวัสดีครับ Hello everyone I'm ไกรชาติ ตันตรการอาภา I'm working at Department of Social and Environmental Medicine Faculty of Tropical Medicine Today I would like to introduce about my research project It's a series of air pollution and health impact assessment in Thailand The starting point of my research is a big problem of air pollution in Thailand As we know it's a critical problem For air pollution It happens every year, both in Bangkok, a capital city of Thailand, and also in other regions, particularly in the northern part of Thailand. As we know, the haze problem. The haze means the particulate matters is a kind of air pollutant over the limit of ambient national air quality standard. That means it might induce impact to the health problems. We start to investigate what are the sources of air pollution and how it impacts to the people because the pathway dispersed from one location to other location. And from that, we found that impact is very important because many people are suffering from that, like the health or the disease or the collapse from the social and economics. As we know, every year and some years, many provinces mention, okay, we cannot operate like the airport due to the haze. Haze means the high concentration of particulate matters in that area. And I also work with the UK team expert. We work together. We investigate by taking a sample from the size many provinces. We try to analyze the particulate matters and some contains like heavy metals in the particulate matters. Some of them might be carcinogen. And we also obtain the secondary data from Pollution Control Department, from Ministry of Public Health, and climatology factors from Meteorological Department of Thailand. And we analyze the data by using the advanced statistical models and other methods to investigate what are the factors influence to the health impacts. The results we found very interesting. The important factors for the air pollution in our country is climatological factor or meteorological factor. Why we found the episodes early in the dry season, but how about the wet season? We cannot see the problem, but it's quite difficult to control. But the second is the health impact and to see the relationship between climatological factor and air pollution and the health impact. And we found that like in 2016, the excess mortality death about 50,000 deaths in Thailand. That means our government has to pay more to treat our people. Not only mortality, about morbidity because they have to go to the hospital. The way how can we reduce the impact from that is it possible to stop from the source? Quite difficult. But is it possible we reduce from the source, minimize the pollutants from the source? For example, many provinces mention, okay, this is the critical periods. Farmers, local people, you cannot burn your agricultural residues. This is a kind of regulations in local areas. And for the people, how can we reduce the exposure from air pollution? We have to inform the people. From our findings, we also have distributions of our paper to universities, to many organizations that involved in air pollution. For example, Pollution Control Department, Ministry of Natural Resources and Environment. We also contribute our research to other countries. We have a chance to set the seminar in our neighboring country like Laos PDR, in Myanmar, and also other regions of like in Europe about our research findings. That's very important. At the last part, we also encourage people to be aware about this one. We also distribute our papers to government to maybe it will be useful or benefit for policy makers. How can we minimize the source? How can we reduce the exposure of air pollution in Thailand? That will be benefit for people. We can reduce mortality rate. We can reduce morbidity rate. It will be good for our health. That is my research. If you are interested to see more or read my paper, you can take a look from the link of my public publication. I think it's, almost of them are open access. You can get the papers. Thank you very much.